Hello everyone, and welcome back to another episode of the P3 Ministry Podcast. I'm your host, Dr. Judy, an internal medicine doctor, holistic wellness expert. And in this podcast, I bring people to you that can share information that can help you to optimize your health. This podcast is specifically geared for Christian women, women of faith, and Christian men as well, because my goal is to help you to live your best life, live the abundant life that God has purpose for you. So today's guest, I'm super excited about having Sue Ellen on the episode today. She's a registered dietitian, and she is an award-winning, nationally recognized nutrition expert, leading global expert in gestational diabetes. She's a mother, wife, author, health writer, recipe developer, and a speaker. She's also a diabetes and fitness expert and a holistic plant-based women's registered dietitian of over 15 years. She has appeared on many different outlets, including Harvard Health Publishing, Forbes Health, and Wall Street Journal. She's a national media spokesperson for the Academy of Nutrition and Dietetics and the founder of 360 Girls and Women, a holistic health and wellness company for girls and women, and a co-founder of Cultured Health, a global digital healthcare company that has an app that connects dietitians to clients based on culture. So welcome to the podcast, Sue Ellen.
Thanks for having me today, Dr. Judy. Yes. I appreciate it.
So today's episode, guys, we are going to be talking about all things plant-based nutrition, vitamins, supplements, protein, all of your biggest questions that I've been getting over the years, and Sue Ellen, I'm sure, has been getting over the years, and just break it down for you in simple terms so that you can make educated decisions for yourself and for your family. So one of the questions that I get a lot is, what's the difference between a plant-based diet, vegan diet, vegetarian, whole food plant-based, and then there's even like lacto-ovo-vegetarian. So I tend to use the term plant-based. That's how I would describe myself. I am not vegan. I have never been vegan, although people put me in the category as vegan. But can you explain to us, Sue Ellen, of the people, the difference between the different plant-based diets?
Yes. So plant-based diets, usually people clump them into one category. And so they have different types of diets. And one of them is the whole food plant-based. Whole food plant-based is based on whole foods like whole grains, brown rice, oats, legumes like lentils, peas, or your, peas that you would eat, like your green peas even. And also it's grouped together with foods such as fruits and vegetables, fresh fruits and vegetables. So the whole food plant-based diet basically gears towards minimally processed or ultra processed foods. So you're not going to see someone that's eating a whole food plant-based buy a lot of microwavable foods that are in maybe canned fruits and vegetables. They're not going to be using those foods as their primary source. They're going to be reaching for fresh fruits, vegetables, making their cereals like their oats, their quinoa, preparing a lot of their foods from home. A vegan is also can be considered a whole food plant-based or just a vegan. There are some vegans that do eat heavily processed foods like, there are vegan cookies, there are burgers out there that are made vegan, but those are processed vegan burgers, right? And so a whole food plant-based diet, they wouldn't use those burgers. They would make them from scratch. But a vegan basically means you're eating 100% plants. You're not eating any animal products. Research has shown that there are several health benefits for eating a plant-based diet, and it is environmentally friendly as well. The next type of diet you hear often is different types of vegetarian. There's a lacto-vegetarian, meaning that you're going to eat milk, you're going to eat cheese, and so they're eating these plant foods in addition to the milk and the cheese. And ovo-vegetarian means you're eating eggs, right? So they eat all the plant foods that the vegans will eat, but they're eating in addition to eggs. And then you also have lacto-ovo-vegetarians, meaning they eat eggs, they eat milk and cheese, and they eat all the other plant foods that the vegans eat as well. And then we have pescatarian. Pescatarian basically means you're a vegetarian and you eat fish, right? So you could be lacto-ovo-vegetarian, or you could be lacto-vegetarian or ovo-vegetarian, and then you're eating the fish. So that's what we call a pescatarian, or seafood, particularly any kind of seafood. And then we have flexitarian. Flexitarian is a new term developed quite some years ago, but it's fairly new to some people. And it basically means you're a vegetarian, eat fish occasionally, and you have minimally other animal foods like meats or chicken and things of that sort. So you may eat something like, chicken once a month, and you may have fish twice a week, and then you're eating a lot of the vegetarian foods that other vegetarians will eat, like, your whole grains, fruits, vegetables, and all those things. So those are the main 4 types: you vegan, vegetarian, pescatarian, flexitarian. And then we discussed the different types of the vegans. It could be whole food, plant-based, vegan, 100% whole food, plant-based. And then there's just a regular vegan. So hopefully I cleared up some of those names for you, but it can be a little confusing. Any questions?
Yeah, thank you. Yeah, it can be confusing. That was a great summary breakdown of them. And also I wanted to add about the term vegan. I've noticed that term tends to turn some people off. And I also want to clarify that veganism is more of a lifestyle. Like, they don't use anything that was either originated from an animal or even tested on animal. Like, there are some foods that in the production of it use animal byproducts. For example, like some sugar requires bone char. I think it's white sugar. And
honey.
There are some other. Oh yeah, honey for sure. They would not use. They wouldn't use leather. Leather shoes, leather bags, things like that. And I find that vegans are a lot.
It's a cultural
stricter. Yeah, yeah. They're purists. I would say, like, they would never, ever, ever eat anything that's not vegan. That's how I found that vegan community to be. Whereas people that don't identify as vegan, but say plant-based, whole food, plant-based, vegetarian, they may be a bit more flex about it. Like, I know some people who are vegetarian or pescatarian, but when they go out to eat, they make an allowance, and then they say, okay, well, once, twice a year, or even like holidays. People that are vegetarian, twice a year, Christmas time, they're eating curry chicken, right? They're eating fried fish, curry goat, something like that. So I know people that.
I know a friend, a guy I dated some years ago, and he was studying to be a pastor. And he said, I'm a vegetarian, but, once a year, holiday, Thanksgiving or Christmas, I'm eating some turkey. And so, that's basically a flexitarian somewhat, because he's eating, but he only has it once a year, right? So these definitions are not to the T all the time, because a person may be vegan or vegetarian 99% of the time. And, they probably still consider themselves that, but we may not, but it's fairly flexible, I would say.
Yeah. And your needs, as far as what your body needs and what you choose, can change throughout your life. That's what I found. I followed a strictly 100% plant-based diet. Whole food plant-based was the goal, although I did eat processed food sometimes. But I'm finding now that I'm in my 40s, and then I had this condition, long COVID, my body requires more protein. So I've started to eat fish, and my body requires a lot more omega-3 fatty acids. So I take a fish oil supplement, and I eat fish. And so, I like to encourage people to make it a personal decision as far as whether you want to go fully plant-based, whole food plant-based, 80%, 90%, 70%, but we got to move more in the direction towards more plants and less processed food. I think that's like the simple answer, summary of the diet wars, right? Because there's so much conflicting information online about diets. You've got so many different people. There's carnivore people that swear by that. They say they reversed diabetes, they lost weight, they eat raw eggs, they eat chicken every day, all day, and they're like, you vegan people, you plant-based people are crazy. And I'm just like, you know what? The truth of the matter is, any diet probably can work for a lot of things, but if you stick to it, right? That's the problem for a lot of people, sticking to it. So it has to be an individual decision, and you have to be fully convinced that whatever diet you choose is the best one for you. That's my thoughts.
Yeah, and I would say, it's best one for you, but also, speak with someone that can help you decipher that particular diet, because if your diet's not planned, regardless of if you're vegan, vegetarian, or you just eat a regular diet, and it's not plant and balanced, you're going to miss nutrients. So the goal is balance. Is it meeting your particular needs during the lifestyle or during the life cycle stage that you're currently in, right? Because at one particular stage in your life, you may need a little more protein, and in another stage, you may not. So it just depends where you are in your life, but balancing the meals are important and having someone help you do that. I know as a dietitian, I'm always looking at my patients' recalls to see what they're eating and then measuring that up with the nutrients that they really need and seeing if they're getting that, making recommendations. So definitely find something that you're comfortable with, but regardless, you want to move towards plants, right? Plant forward thinking, and then working the foods that you like, if that's possible.
Yeah, that's so true. The standard American diet is terrible. It is so processed. Now, when I'm in the grocery store, most of my groceries come from the produce section. And the middle aisles, it's just so pathetic how much processed food is in the grocery stores, especially in the US. I find that in the West, it's even more it's more processed than, let's say, in the Caribbean, continent of Africa, Europe, even Asia. I've been all around the world, and there's definitely a difference in the food in America. It has more high fructose corn syrup. There's more sugar in everything. And I recently, sodium is in everything. Yes, sugar, salt, and fat. They got the 3 combination to keep us addicted to food. So,
Definitely. And I would say that as just a play on words, people always say processed and ultra processed. And I just want to clarify that, processed foods we eat all the time and they're generally fine, like, tofu, soy milk, those are processed, right? Because it has to go through a process to be filtered, to be cleaned, washed, and then broken down. Even fruits that we pick, they're somewhat processed because they may be washed, maybe picked from the tree and then washed. That's a particular process. But when we're thinking about ultra processed food, we're thinking about these foods that are in containers, or even certain cereals are adding a lot of ingredients and additives, coloring, flavors, salt, fat, and sugar, but in addition to those other things, that's what's going to make it ultra processed. Not just the salt, fat, and sugar, but also the additives, that you're adding to those foods and those burgers, even veggie burgers. So we got to be careful. But like, as you said, I would agree that we have more ultra processed foods in America, and it's definitely not helping us, because studies show that, that decreases your life expectancy, that increases your risk for diseases, so we definitely want to make sure we're eating. When I say move towards plant-based, I like to say move towards more whole food plant-based. There's no way that you're gonna not eat a processed or ultra processed food ever. I mean, you can not eat it, but if you're traveling on the road, if you have children, there's certain things that you may not have, then you may have to pick up a particular nutrition bar or some kind of food that's not the best, but it's what you have at that moment.
Yeah, that's a good point. Making an individual decision and eliminating the processed foods as much as possible. And instead of focusing on just whether it's plant-based, because some people will say, okay, well, Impossible Burger's plant-based, Beyond Burger's plant-based.
But it's ultra processed.
But it's not healthy. Yeah, I don't consider that a health food. Same thing with other things that, actually, a lot of this processed vegan meats. I recently
a lot of the vegan meats are
vegan meats.
Processed. I don't really eat them. I eat my tofu and I make my own burgers, veggie burgers, or maybe occasionally if I'm going to a barbecue or something and they have a veggie burger, I'll eat it. But at home, I make my burgers from scratch. I make my tofu, I have the tofu and I prepare it into particular, chicken nuggets for the kids or loaves or whatever. But all the veggie burgers are ultra processed, unless they only have maybe 2 ingredients. If it's salt and tofu and a seasoning, maybe it's not. It's still processed, but it's not ultra processed because there's a different level.
The homemade burgers are so much better, for sure. And I make tofu too, and I don't buy the processed meats. If I'm out at a restaurant, maybe once every other month, I might eat a processed veggie meat. But tell me about these chicken nuggets that you make with tofu.
Yeah, so I just basically get the tofu, I press it, or just take a towel and take out the water. And then I make a batter. It could be a chickpea batter, season it with some kind of flour batter that's wet. And then you season your tofu and you have a dry, whether it's breadcrumbs or, some type of crumbs that you're going to have. So you have 2 different containers, and then you take the tofu, you put it in the wet, and then you put it in the dry, and then you batter it up, or you could put it in your oven. You could bake it, you could even fry it, but I tend to put it in the oven because you could do you could have a lot of them in the pan at the same time. You could spray it with a little oil and you bake it and flip it on each side, and it comes out very crispy. And my kids like it, you know, so I try to, as much as possible, reduce the packaging or the ultra processed food and make my own and make them in large batches. And that's one thing we could talk about is meal prepping, right? Because a lot of people say, oh, if you're plant-based, you can't eat this, or meal prep, you know, whatever. But that's one of the things that I make that's kind of kid-friendly, or if you like nuggets, you like those. So
yeah, I like that idea. I made fried oyster mushrooms. That's really good. But I need to try it with tofu. I don't usually put a batter on my tofu, but I do bake it.
Yeah,
so it will be the same thing. What do you use for the wet?
So you could use
milk.
You could use soy milk or any plant-based milk, and like a little chickpea flour, or any type of, you know, flour that you want to use to batter it. And it just needs something wet, and you season that also, the batter, and then you toss it into that. You know, like you're making fried chicken, like in my country, in Jamaica, we make fried chicken. You have the egg wet batter, then you have the dry batter. So it's kind of the same thing, wet and then dry. You baste it, and then you fry it or you bake it.
Oh, I love that. I am so going to try that for sure. So now I wanted to ask you, you mentioned you're from Jamaica, I'm from Bermuda. So how can people eat plant-based that still adheres to their culture? Because when I used to do primary care and, you know, in North Carolina, the South, people would often say, you want me to be plant-based? I can't stop eating bacon. I can't stop eating that. And they think of all these delicious soul food items, right? That they're like, oh my gosh, I can't give that up. So what are some ways that you've learned how to incorporate your Jamaican culture, Caribbean culture into your dietary habits?
Yeah. So I want to address that point. Like, there's a lot of myths out there about plant-based. You can't eat this, can't eat that. And I hear all the time from my patients. And when I tell them I'm plant-based, they're like, what? I'm like, yes, but it's good. I make good food. And so an example I want to give you is like something like rice and peas. That's cultural, right? Jollof rice or Haitian rice. They call it dietary Dijon. Or, you know, if you're Latino, arroz rojo, any rice that you want, you can make it an ethnic part, cultural part of a part of you, or a part of your culture, right? You just add those seasonings and cook it the way that you're used to cooking it, because those typically don't need meats, right? So those are just rice. So your starch meals, like your plantains, your yam, your yuca, all those things are still your cultural foods. You're not getting rid of those, right? Now we're talking about the proteins, like how do you make those proteins taste the way that you used to? So again, instead of curry chicken, you do curry tofu. There's a way that you can dry the tofu to make it chewy. You put it in the freezer and then take it from the freezer, put it in the fridge to defrost it, and it becomes more chewy when it's time to cook it. Also, things like oxtail or stew peas, you could make those substitutions with the chewiness of the meat with jackfruit, because it stretches and it's like, you know, that meat texture. Or oyster mushrooms, like as you said, you could create those meals over into those same seasoning and sauces and spices that you use, but you're substituting the protein for a plant protein, right? And you're still using those starches. You're still making your dumplings, your plantain, your yam, your rice and peas. All those things will still remain the same. Around your vegetables, they're not going anywhere. Your fruits, your mangoes, and all those star apples, all those things, they're not going anywhere. So you're still eating your cultural foods. It's the perception of, oh, I can't eat the protein foods. I think that's what it is. And so when you find a good substitution to create those meals, the same sauces and seasonings, then you'll enjoy them. And our taste buds change over time. So we just have to learn to train our taste buds also, because usually it's the consistency or the gravies that we're missing. It's not so much the meat once we become plant-based. It's just the way that, you know, you're used to eating it. And so once you find out how to create and make those substitutions, I think it'll be a great transition and you'll get used to it.
Yeah, that's so true. It's a mind over matter thing, because people think that it's harder than it is. I think they think it's more expensive than it is, and they think that it can't align with their culture, not realizing that a lot of the foods that they already eat are plant-based. It's just so funny. And there are so many substitutions for meat. And truthfully, meat in and of itself does not have flavor. It's flavored because of the salt, the seasonings, the spices, and the herbs. Right? We are not even really supposed to be, I don't think we're really designed, like as far as our teeth, our jaws. We're not really designed to be eating meat like that. If you look at true carnivores, like lions, they go out, they hunt, they eat it raw. Okay, they don't need to cook it, season it, and all this stuff. Right. Their jaws are structured differently to
Exactly. We're having a conversation, right? That, we're not lions. We can't structure our teeth or canines to eat and rip meat apart like that. And we can't do that. We have to cook it. We got to season it. We got to tenderize it. All this stuff. We're not meant to eat that. I mean, but we're eating it for exceptions and because of the flood and different things, if you believe in those principles. But I just understand that once you become, and I understand and I see it in my patients and myself, once you eat more plants, your inflammatory, the way how your body processes food and your inflammation in your body definitely decreases. And why? Because fruits and vegetables, nuts, seeds, legumes, whole grains are anti-inflammatory in nature. So when you're eating a more pro-inflammatory diets, you're eating foods like fried food, processed foods, ultra processed foods, and you're eating a lot of those heavy meats and things like that. So the cured meats, and those are the ones that are pro-inflammatory, right? So when you're eating more of those, your body's going to feel aches and pains. You're going to have more issues that's occurring in your body. I mean, research shows it, right? They've done study on people who eat more plants, and you see whether it's vegetarians or vegans that their risk for certain chronic illnesses are lower. So I just feel that, once you start eating this way, you will feel better. As long as you're not eating a lot of those, like I said, heavy vegan or vegetarian processed foods, then I think that you'll feel better overall. Didn't you feel better when you switched to more of a plant-based diet? I sure did.
Yeah, for sure. I definitely think it contributed to me having clearer skin. That was one issue that I had, and more energy, I would say. Yeah.
Yeah. Yeah.
And people also of all faiths say that they felt a increased spiritual awareness, or something like that when they became plant-based. And some of these people are, I don't know what you call them, but they're not Christian. They don't even really identify with any particular faith, but there's like some spiritual awakening, right? Where they're more aware of their inner body and their mind, body, spirit connection. They're more in tune that way. So that's why I say for people that are, Christians, this is the community that I speak to. Eating healthy, eating more plant-based is not just about your physical health. It actually enhances your spiritual health. Like I found that since I've been eating plant-based, for me right now, it's probably been about 10 years.
Okay.
I can definitely say that my ability to discern things in the spiritual realm is increased, and my ability to hear God's voice is increased. I firmly believe that sugar is it's like alcohol. Like it slows down your body. It slows down your brain. It slows down your immune system.
Yeah.
Like I can feel it.
Well, you could feel it because your studies are true, because it does show that excessive sugar intake increases your cancer risk and increases your disease risk. There are studies I'm sure of them, but I could drop them out to you. I can't remember them by name, but there are studies that show that added sugar, added sodium, added, fats, these increase inflammatory cytokines in the body. So you're going to get these inflammatory issues. You're going to have pain. And when you're having this issue, you're not thinking better. When you're not thinking better, you can't discern things mentally or spiritually, right? And so one of the things I like to say is your hippocampus, right? Your hippocampus is basically really important because it could shrink and it could grow. And when you're eating ultra processed foods, that's going to shrink it. And there's also studies that show that certain nutrients, if you're missing from your diet, that's going to shrink your hippocampus, and you don't want that to happen. That's where you make decisions. That's why you get your mood, and there's a lot of information going on in the hippocampus. And so when you think about spirituality, when you're able to think and make decisions and to have a calmer mood, if you're not eating the foods that's going to cause you to grow your hippocampus, or to think properly, how are you going to discern things and to do even your work or your schoolwork or your regular work, or the work God wants you to do? How are you going to think about that? Because your mind's crowded with particular foods, and studies show that you can't think straight when you're eating that way. And people with mental illnesses, they show that diet plays a great factor in helping and recovering the brain and to heal it. So spiritual, mental, and physical health, I'm all for that. That's what I do at 360 Girls and Women, and I do feel that I can hear things better in my mind when your body is in a better place. You're in tuned,
Yeah, for sure. Sugar gives you a high, almost like drug addicts. Basically, it's an addiction. And you can literally get hooked on. Yeah, it can be. You can literally get hooked on it.
Yeah. I would say anything can be an addiction if you make it, but
I think it's hard though for vegetables to be an addiction though. Anything unhealthy, you mean?
Yeah, I would say anything unhealthy, like temperance, right? So we talk about temperance temperance is basically, being careful in the things that are good for you and avoiding the substances that are harmful. Like we talk about drugs and alcohol, those are harmful for the body, and studies show that. But we know that, right? But as far as, exercising, we know that's good for you. But you can be intemperate or not temperate in exercise. You could over exercise, you could harm yourself, you could, become an eating disorder if you could adopt an eating disorder behavior if you're eating and then exercising and trying to burn it off. So it could become a thing that's not right. And you could overdo that, and you could overeat. Everyone knows that you could overeat. So eating is good, exercising is good, but it's like temperance and those things. But yeah, vegetables, I got you. Yeah, I don't think you could overeat vegetables, but it could come to a point where you're overdoing something and you're not going to have gas or something's going to happen to like the bowel movements, or be temperate in those things too. So.
Yeah, I'm so glad that you bring up temperance. That is very, very important, especially for the believer as well, to be temperate in all things, especially the food that we eat. And it really bothers me. It actually breaks my heart a little bit to see people of faith struggle with food so much, when I know God can give us the power to overcome everything. Yes. But I think people don't often think it as serious as it is. I think they think it's just like not a big deal, because everyone eats unhealthy in America, basically. In the world, probably, but especially in America, because that's where I live. I can confidently say that, in my opinion, from what I know about health, most people have an unhealthy diet. Those people, there's actually a study that talks about that. It was saying, it was looking at how many people actually have 4 of the healthy lifestyle behaviors. It was healthy diet, not smoking, regular physical activity, and a normal body weight. And only 4% of the people in that study had all 4 of those healthy behaviors. So healthy behaviors and healthy eating is extremely low, right? So it can seem normal. And I think this is part of the problem. Unhealthy living has been normalized in our culture.
It has been normalized. Yeah.
And you go to restaurants, they give you too much food. Like most time at a restaurant, the serving is probably should be 2 meals. Probably.
Yeah. Or maybe 3.
Sometimes 3. Yeah.
No, I educate my patients on, when they dine out, if and when they have to, take some of the food to go in a box, because you're going to be eating more calories than you really need. A lot of patients that I have, a lot of girls, women, they're trying to lose weight. I have perimenopausal and menopausal women that are trying to lose weight, or women after having a baby. And they're like, I struggle with the portions. And when we go out and they take a picture of their food and I analyze it, I said, wow, maybe next time put half that pasta away, add more veggies, add some no butter, add the salt, the dressing on the side and different things, because that saves a lot of calories. But going back to the portions, I've seen food. I've gone out and I've seen patients take photos of their foods. I'm like, wow, these portions are just huge. So one of the tips I tell them, take a to-go box, portion out what you're used to eating at home. I teach them how to eat their portions at home. Once they know what it looks like, they can automatically say this is too much. And before even picking their fork up, they get a to-go box and box it up. There's more tips, but that's a big one.
That's a good idea, to put it in the box before you start eating. Yeah. I usually do that when I'm at home, but I don't do that when I go out. I guess it never occurred to me, but I purposely do that at home because I know what you're talking about, the amount that you want to have on your plate. Yeah, that's really good. So I wanted to switch and ask you about vitamins and supplements on a plant-based diet. What are the vitamins that people should be paying attention to, and nutrients?
Yeah, so one of the vitamins that are typically low in, if you're following like a vegan, vegetarian, or just mainly vegan, or just a strict plant-based diet, iron. And a lot of women struggle with iron, regardless if you're eating plant-based, right? Because, you can get iron from animal products. And I see women that still are, anemic or have iron absorption issues. And so one of the ways, if you're eating plant-based, is to have, spinach, a half cup of spinach is like 3 milligrams of iron. You need about 8 to 18 milligrams of iron, depending on your age and where you are. But lentils, a half cup of lentils is 3 milligrams of iron. Pumpkin seeds have also lots of iron. And so when you're adding those foods up in a meal, half cup pumpkin seeds, spinach, that's already 6 milligrams of iron out of the 8 or so that you need. And if you add the pumpkin seeds to that and more spinach, or you could also add, in the morning, fortified cereals. For anything fortified, it's going to have some iron in as well. And so that's another way of boosting your iron. One thing with people who are vegan or vegetarian, if you're eating plant-based iron, you want to make sure you're eating foods with vitamin C in it. So let's say you're eating tofu. Tofu also has about a half cup, 3 milligrams of iron. And if you're eating tofu, you could mix the lentils on the side. You have your spinach or your other green leafy vegetables because they typically have iron anyway, right? Then and those green leafy vegetables also have vitamin C, like broccoli, right? Or you could add tomatoes, which is a good source of vitamin C as well, to the meal, right? So those are some things you could do to boost the iron content of your meal by adding vitamin C, because iron that we're speaking of is the non-heme iron, and you need to have vitamin C to absorb that non-heme iron. And another nutrient is B12. Sure, a lot of people hear about B12 as well. And so B12, where can you get B12? You can get it from nutritional yeast. About a tablespoon of B12 has like 11.6 micrograms of B12. You need about 2.4.
A tablespoon of the yeast has how much?
About 11.6, approximately 11.6. It has a lot. Yeah. Okay. And so all you really need is probably about 2.4, 2.8 micrograms per day, again, depending on your need, where you are in the life cycle. But nutritional yeast has a lot of B12. Of course, fortified milk products like plant milk, like soy milk, is going to have the B12. And then the cereals I mentioned, but you definitely should take a supplement if you are older, especially. Absorption of like a body binding B12 as we get older maybe decrease. Even iron with the intrinsic factor and stuff like that in our gut and the acidity in our stomach as we get older, if you're menstruating, and then, older women also. So an iron supplement and a B12 supplement may be something that you want to look into if you're plant-based. You definitely want to get your labs drawn by a provider to make sure you're monitoring that. I monitor my patients' labs and I have them get regular screening, and then we follow up with their diet. And if they need a supplement, I recommend a supplement. Another nutrient to think about is calcium. Calcium also, and I would say vitamin D. So vitamin D is kind of hard to get in the diet, right? Because even if you eat animal products, you can get some vitamin D, but not a lot. So there's vitamin D in fish. There's vitamin D in like salmon, right? Sardines, the bones. But if you're flexitarian, but if you're vegan, you'll find some vitamin D in mushrooms that are UV treated mushrooms. UV treated mushrooms have vitamin D, and the vitamin D that you want to make sure you're getting it's D3. D3 is what you're getting from the sun, and it can also provide some D2, but most vegetarians are getting vitamin the D2 type. But regardless, your body needs sunlight, so that's my next transition. It's hard to get in a diet. There's not much foods that are abundant in vitamin D, especially on the plant-based side, but you want to make sure you're getting outside. I mean, if you have more melanin in your skin, you want to make sure you're spending a longer time in the sun, at least half an hour. You're not using sunscreen. If you're using sunscreen, it basically means that you're blocking some of the UVB rays, and you don't want to do that. You need those UVB rays in your body to make sure that you're transitioning to the active form of vitamin D. So calcium foods, going back to calcium, you find them in tofu, of course.
I wanted to go back to the vitamin D. I find it actually pretty common people of color to be deficient in vitamin D, even if they're not plant-based. I got my levels checked regularly. When I was seeing patients, I would check the levels on everybody. And I was surprised at how often someone's level was low, even though that was not what they were having symptoms of or anything like that. Right. I mean, like really low, like it should be above 50. You really want it above 50. Some people even say closer to 100 if you have certain conditions. Right. But I've had people with like 10, 19, 20. Yeah. And it's really important for your immune system. Discovered your memory, bone function, of course. But, right now with COVID, I'm really focused on the immune system. Yeah.
With diabetes, also I've seen my patients, if you have low vitamin D levels, you're higher risk of insulin resistance. So you got to make sure that you have vitamin D to help with blood sugar regulation, immune system regulation, hormonal regulation to help you with your sleep. That's also important. Bone function, as you mentioned, And, calcium and vitamin D work together. And we talk about, calcium for your bone, but we also need the vitamin D and we need that magnesium too. But to work together, right? Because it's like your bones are made of different mixtures of elements. But yeah, vitamin D is super, super important. And we are all deficient. Well, almost all of us. It says, I think there's a study that says about 60% of the population is deficient in vitamin D. And we don't get it checked regularly, and we're not out in the sun enough, and we're using a ton of sunscreen. Okay, so
yeah, and most people aren't even in the sun during the day. And then again, when we're in sunscreen to prevent skin cancer, because that's what the dermatologists say we should wear. But then it's like we ain't getting the vitamin D. So I'm like, just take a supplement, check your level, and don't just check it once. I check mine probably more than some people do. Every year I'm checking it because my level has been low, and I find that it fluctuates. It fluctuates every year. So I wouldn't recommend people to even just check it once every 3 to 5 years, especially
every year.
You may need an extra doctor for it because I'm not sure if it's standard.
I asked my primary care provider, I want an annual vitamin D because it's that important. I mean, your risk for so many different cancers go up when your vitamin D is low. I mean, it's really serious. Like a lot of our vitamin D levels are not where it needs to be. Yeah. So, the fortified foods, cereals, sometimes they even put calcium and vitamin D in orange juice. Not to say you should drink a lot of orange juice, but getting out in the sun is your best bet. I mean, those UV treated mushrooms. And then in terms of calcium, you get calcium from your green leafy vegetables also, like a cup of collard greens equals to about the same as a cup of milk. So eating those collard greens daily, getting those fortified foods from like the oranges. Even a whole orange has a little bit of a calcium in it, a regular whole orange. And we need about 1,000 to 1,200 milligrams a day. So we want to make sure we're getting that, especially in older women, but all stages when you're pregnant, your adolescence, pregnancy, breastfeeding, everywhere. You just need calcium overall. And soy food, tofu. You have a lot of calcium there. Like half a cup of soy milk is like 130 milligrams of calcium. So you can get calcium from the tofu as well and the soy milk. So
if someone eats, how much greens would someone need to eat to get enough calcium? Let's say they eat a mix of beans and tofu with each meal, and they're trying to eat some greens too.
You probably need to eat, if you're having 3 meals a day, you can have a cup of greens at lunch, cup of greens at dinner. That's almost 400. That's almost 800, right? If it's 360, you can round to 400. So you need about 1,000 to 1,200. So that's 800 right there. And if you're at a cup of milk in the morning, or you're eating yogurt, that's soy-based yogurt, or if you're eating tofu with your meal, like 4-ounce tofu, you're basically meeting your meal. So you have your milk with your breakfast, a cup of milk, you've gotten like 260 there, right? And then if you have an orange part of that breakfast, that's like another 60 or so. Okay, so you're adding that up, and then you're eating the cup of greens for lunch and dinner, and you already made your 1,000 a day. So if you think like that, like what are some foods that are high amounts, that provides high amounts of calcium, and you balance your meals that way. I'll have breakfast, I have a calcium food, also have a meal that has protein and iron, right? And then so you also want to make sure lunch and dinner, do I have green leafy vegetables? It's going to be greens. It's going to be spinach. What exactly is it going to be? But if you have greens regularly, you're going to meet those needs. If you're having vitamin C foods with the heme, the non-heme foods like beans, lentils, and peas, you're going to be meeting your needs. And also legumes have calcium and iron. So by balancing your meals that way, and I do that for a living for my patients, I balance your meals to make sure they're having the right amount of nutrients in these top 4 nutrients. And there's more, like I said, iron, B12, calcium, vitamin D. Those are the main ones, but there are others. And I would say when you're making your meals, think about what foods that you want to eat in the week and how can I balance those foods to make sure that I'm meeting my needs. And like B12, for example, the nutritional yeast, you could add that when you're making your breadcrumbs for your chicken nuggets or tofu nuggets. When you're adding your little breadcrumbs, you toss a little bit of nutritional yeast in those crumbs, and you're getting it that way too. You could also put it on salads, a sprinkle of nutritional yeast on salads. So there's ways to get B12, all those things. A lot of good tips and tricks I could teach you.
I try to eat green leafy vegetables every day. I eat 1 or 2 meals a day. So I try and eat it with every meal if I can. Doesn't always happen, but sometimes I eat
Yeah.
a smoothie and just put like 3 cups of greens in it and like just a little bit of strawberries and bananas. And then I get
Yeah.
like a big super
And
dose.
then you can put nuts in it too. Nuts, they have some pumpkin seeds. They have lots of iron there, and you could add those to smoothies. I usually introduce pumpkin seeds in a lot of my patients' smoothie recipes because a lot of my patients are women, and a lot of them are low in iron. So pumpkin seeds are your friend.
Oh, I love pumpkin seeds. I put them on salads too.
Uh-huh.
So what about milk? What are the dangers of eating cow's milk?
Well, as a plant-based dietitian, I would say that I may sound biased, but I would look at the studies. There's one particular study that talks about how milk consumption increases risk of autoimmune, like type 1, to their child. And that study's been out for quite some time. Some people challenge that study, but they also have a study, I think that same study where in another country where they eat a lot of cheese and milk products, and their rates for type 1 diabetes are higher. So there's some kind of correlation there, right? It doesn't mean it's causing it, but there's an association there. And so another thing with dairy milk, which I don't recommend for my patients or my family, because it's increased risk for acne. A lot of my women, when they come into the clinic, in my clinic, they have a lot of acne. When I put them on a plant-based diet, I start them out on like a mainly raw also, and I give them a lot of whole grains. Those aren't raw, those are cooked, but I give them like fruits and vegetables, tons of smoothies and juices and whole foods that they're eating, and like within a few weeks their skin clear up. Take them off dairy, like, oh my gosh, like I think it's the dairy, and then if we reintroduce it back, their skin breaks out. So I would say 90% of my patients, if they're eating dairy, it's a reaction that's causing inflammation. And another thing is, when we think of individuals in the place of culture, right? Asian American, or just Asians overall, certain culture like Asians. And I also know that Blacks as well, right? Whether you want to say you're Afro-Caribbean or you're African American, wherever you are in that trajectory, we know that in the African diaspora, we don't have that enzyme. Not all of us, right? We suffer with lactose intolerance, so we're not digesting that. So it's causing GI upset, inflammatory reactions to us. Even when we take out the lactose, there's also the whey and the casein and other things in the milk that may be problematic. And so I would say those are the reasons why I would avoid it. And then the third reason is there are strong evidence out there that says increased risk of dairy, particularly I think cheese, not so much milk, but particularly cheese, that increase your risk for breast cancer and prostate cancer. So when we think of dairy overall, I don't recommend that to my patients. I have them swap it out. Now I have had dairy in the past, and my children, I just became plant-based really fully like 7 years now, right? And so in my family, they're still moving along that trajectory, and they don't follow everything I do. But I would say that if you're eating cheese, milk, and yogurt, try to wean off the dairy, because there's studies out there that says it increases your risk for breast cancer, prostate cancer. Also, environmentally friendly. It takes a lot of CO2 is given off a lot when you're eating these products, right, into the environment. But when you think about your skin, your overall health, and your gut health, I think that it may not be a good option for a lot of people.
Yeah, and there are so many good plant-based milk options now. You don't even need to drink cow's milk. They've sold us really on a lie, to be honest, when they used to have these commercials growing up about milk, and they really brainwashed us, that's my opinion, to think that you have to get milk to get calcium. So I love having these conversations about plant-based sources of calcium. And actually, there's studies that show that drinking milk does not decrease your risk of osteoporosis. It actually increases it. It actually leaches calcium from the bones. Is what I've read.
Yeah. And the reason why it does that, because of the phosphates and because of the high protein diets and high diets that have a lot of phosphorus, leaches calcium from the bones. And animal products are typically, certain animal foods have phosphorus in it, and they have, plant foods have some phosphorus, but the type of phosphorus we're looking at and the type of protein has put stress on the bones. And so when they looked at that study, I think I know the study talking about that drinking milk doesn't really reduce your risk for osteoporosis or bone health. It doesn't really decrease your risk, but it increases it, right? Because you're weighing those biomarkers from the protein load. I think it's the kidney urinary protein load, from the kidneys and reduce. I don't
remember the mechanism. It's a few studies that I've read that kind of alluded to that.
It has something to do with protein and the phosphorus and other things. But yeah.
And in functional medicine, which they're not really plant-based in the functional medicine space, but if you have a patient that has gut issues, autoimmune conditions, skin issues, first thing they recommend is elimination diet, which one of the things they eliminate is dairy. There's other things they eliminate too, but dairy causes a lot of problems for a lot of people, and especially people of color, like you say, at least 70% are lactose intolerant. So we really shouldn't be drinking powdered milk.
Yeah, for sure. And I use the elimination diet on my patients too if they're having issues, gut or autoimmune or other issues. But yeah, I definitely feel that there's so many great substitutions for it. You don't necessarily have to drink it. Based on what I know, I don't recommend it from my family. But again, if, there's other people that drink it, eat milk, cheese, and yogurt, all that. And so it's definitely up to them to make a choice, right? Because all my patients that I see, I can make a choice for them. I give them all the studies and the data, and I review the data with them in a way that they can understand. And I say, hey, it's up to you if you want to choose to be plant-based, to be pescatarian, halfway, vegan, whatever you want to do. I'm here to help you through that plant-based journey. But these are the studies that I use, and these are the reasons why I recommend what I recommend. And then they make the choice. I don't force them, but
they always have to make their own choice for themselves. But so I wanted to ask you, so people are often worried about protein. They think they're not getting enough protein. It's almost like people are overly focused on protein. And so how does someone on a plant-based diet make sure that they're getting enough protein? And how much protein should we be getting? Is there like an amount to aim for?
Yeah, so first, I think protein needs are based on, your age, your sex, your activity, your medical status. So everyone's protein needs are different, but typically the RDA recommended daily allowance is 0.8 grams per kilograms. So you multiply that times your weight in kilograms, you get the protein that you need. But if you're in an acute medical illness, chronic illness, if you had surgery, pregnant, postpartum breastfeeding, if you're in menopausal state, those proteins are going to be different. If you're active, for example, if you're weight training or just you're very active throughout the day, your proteins are going to be different. It's not going to be 0.8. So that's just the baseline, the RDA. And some people say even we need probably more, maybe 1 gram per kilogram. If you're 60 kilograms, and then you maybe need 60 grams of protein, because some people believe it's 0.8 to 1. But typically the RDA is 0.8, even though the RDA is based on, most of the population and the healthier general recommendation for the healthy population. I feel that there's some flexibility there. And that's really for adults too, right? And so, like I said, plant-based diets do provide protein, and here's how. If you're eating vegetables, all vegetables have protein. So we're talking about those collard greens, those kale, those cauliflower, broccolis. Every single one of those have some protein, right? So I calculate protein there when I make meal plans for my patients. In addition, we have foods like these starchy foods that you may think, oh my gosh, there's too much carbs. Potatoes, they have protein. This is sweet potatoes. Your butternut squash.
People often don't think that vegetables and starches have protein. They think protein only comes from meat, eggs.
Exactly. Animals. Right. And so they're like, oh my goodness, all you're eating is like a salad with peas, even green peas. Green peas have protein. Chickpeas, lentils, quinoa is a carbohydrate, but it has a significant amount of protein. And even buckwheat has protein. So some of my high protein grains are the quinoa and the buckwheat. And you're like, oh my goodness, all I see are oats. I see oatmeal you're eating for breakfast, but if you could add more protein to your oats, you could add some handful of nuts. You could add almond butter to that as well. You could add the pumpkin seeds. The pumpkin seed, we talked about the iron, but it also has protein, right? So there's so many things you could do in the morning, breakfast, lunch, or dinner to your meals to add protein. So I think that's one of the ways we need to change our mind, is that vegetables have protein, and plant-based eaters, vegan, vegetarians, or pescatarians, or flexitarians, they're eating a lot of vegetables. So you're getting some protein there. Then you're going to add foods like tofu, like tempeh, like beans, lentils, and peas at meals so that you're getting the protein you need. Half cup of cooked lentils, about 7 grams of protein, right? So if you have a cup of lentils, that's 14 grams of protein, right? And then if you add tofu with that, in your 3 or 4 ounces of tofu, your protein adds up. You're going to be hitting the 30 grams to 20 something grams of protein at each meal. And we haven't even counted the protein that's in some of the rice or the pastas or the vegetables, because there's proteins in grains too, right? Proteins in grains, proteins in your starchy potato vegetable, foods, and there's protein in non-starchy vegetables like your kale, broccoli, carrots, all those. So not much protein in fruits,
So
very little to yeah,
so
like
it basically
jackfruit.
all adds up.
Yeah, it all adds up. All those protein sources add up. And so tofu is my favorite because it's a complete protein and has all of the 9 essential amino acids. And so I always try to add that several times in the week to make sure I'm having that as well. And it also is helpful for your hormonal balance because it provides plant estrogen or phytoestrogens. So yeah, that is definitely a myth. I plan high protein plant-based diets for my patients all the time. The ones that are in these stages, if they're postpartum, breastfeeding, surgery, or the menopausal, whatever stage you're in, I'm planning a particular meal. They may not all need high protein, but based on what they're already eating, I evaluate what they're already eating, and then I modify it to what they need to meet up to make that change. So definitely a myth. And also the thing is, we don't need that much protein. Again, we're probably overeating protein. We're overeating simple not simple, but like processed carbohydrates, like the chips, cookies, cakes, pie. We're overeating those processed carbohydrates, and we're eating less of the grains that we need. And so we're just
less of the whole grains.
Right, we're eating less of the whole grains. And we're eating tons of protein. Half your plate for some people are protein. I'm like, why do you have half your plate? A piece of chicken, steak, fish, whatever it is. Why are you eating so much? Like, what are you doing? Are you weightlifting? Like, weightlifters
not even active.
Right, weightlifters need excessive amount of protein. At a higher amounts than typical layperson, and so, because they need to recover muscle tears and stretches and all those things when they're lifting those heavy weights. And so when we're thinking of a regular person coming home from dinner and I see them order, I like the steak and broccoli. I'm like, where's your carbohydrates? And half your place is steak? I'm like, wow, you're eating like a 12-ounce steak and broccoli.
Yeah, people think that protein is the most important thing. And I tell people to shift their mind around their plate. At least half of your plate should be produce, vegetables.
Vegetables. Yeah.
At least half of your plate, a quarter protein and then a quarter whole grains.
Yeah. Plate, yeah, exactly. The plate guide is what I teach my patients, similar to that. But yeah, half your plate, if you're eating lunch and dinner, vegetables. Lots of vegetables.
And your taste buds change too. Once you eat more unprocessed foods, healthy foods, your taste buds will change. And you'll start to love vegetables. Like, I love vegetables now. I love fruits. When I eat things that have sugar in them, I don't even really like it.
Yeah,
it just tastes
too much.
Toxic. It tastes too strong, too pungent. Like apple pie. Apple pie to me tastes like so fake and sugary. I can't stand
sugar. Yes. When you go out to a restaurant and you order a certain meal, and I'm like, wow, this is salty because I reduced my salt.
Yeah, same.
I'm like, I can't eat this. It's too much salt. Or what I ask them, I'm like, can you make my vegetables and steam it? No salt, no butter. Because, the butter and the salt and those things are going to add up. And this is like amazing when you go out. They're using excess salt and butter too. We think it's the foods in the packaged containers at the stores, but also when we go out to the restaurant, it's tons of salt there. Unless you're telling them in advance, please not do this. I talk to my chef and the waitress all the time when I go out, because I guess because I'm a dietitian, I always do that. Or, I'm sure you talk to them as well as a physician who's in the plant-based realm. But I'm always talking to the waitress or the cook or chef or ahead of time. I tell my patients, call ahead of time. They could also prepare sometimes a special meal for you if you request it. You could always ask. The most that they could do is say no.
Yeah, so I usually check the menu, call ahead of time, and I ask a lot of questions. And I want to share for our viewers, if you're someone who is looking to eat more plant-based, who wants to detox, increase your spirituality and your faith, I'm hosting a 21-day plant-based prayer and fasting challenge. It's called the P3 Fast. It starts on August 29th. I'll have the link in the comments so you can sign up for that. If you sign up for VIP, you also get whole food plant-based recipes. that are sugar-free, salt-free, and oil-free as well. And the purpose of this 21-day event is to basically cleanse your body, your mind, body, and your spirit, to eat whole, unprocessed foods, no sugar, no salt. And then we also are going to be fasting in the biblical sense each day if possible. The target goal is, I've set a number of hours, but each person obviously can decide how they want to do it over the 21 days, but it's a spiritual fast that also has physical benefits as well. So I'll put the links for that below. And then also I want to share for you viewers as well, I am partnering with Complement. It's a supplement brand that is vegan, very, very excellent company as far as the standards for the production of their supplements. And they have a vegan multivitamin that has vitamin D, vitamin B12 in it, and magnesium, and also has omega-3 fatty acids in it as well. They also have several other supplements such as creatine, and they have vitamin B12, and they also have omega-3. So we'll put the links for that below. So I just want to kind of put that in there. But yeah, so this was really good, and we could probably talk for another hour, I'm sure. But we are going to kind of wrap it up now. So we've talked about plant-based diets of different kinds. We talked about vitamins and nutrients, protein, eating plant-based that fits with your culture. So hopefully everyone feels more confident, I would say, in their ability to eat more plant-based. Wherever you decide to start, it's your journey. Reach out to someone, reach out to a dietitian, reach out to a doctor, find a plant-based doctor, plant-based dietitian to help you in that journey. You don't have to do it alone.
Yeah.
And dietitians are underutilized. Physicians don't refer patients to them enough, and patients just don't see them enough. And I used to think that you needed to see one if you had chronic kidney disease and uncontrolled diabetes. But as I've been on this nutritional studying journey myself, I realized that there's so much value in everyone seeing a nutritionist. Everyone, especially if you have one medical condition. I would say if you have hypertension, if you're perimenopausal, if you're menopausal, if you're pregnant, if you're breathing, no, I was kidding. It's a good idea. See a nutritionist.
Thank you for saying that. Yes, we're underutilized, and many providers, even you admitted, we don't refer out, especially when we have a complicated situation or just maybe just a nutrition concern dealing with pregnancy, sodium, blood pressure, not just kidney disease, not that you're on the last stage and you need to see a dietitian. Now is time. We do prevention as well, right? It's not just as you're diagnosed, but even just prevention checkups, covered by most insurances, or if you want to do out of pocket. But yeah, thank you, Dr. Judy, for mentioning that. We need to work together. I refer my patients to see their provider all the time. And I actually, when I see my patients, I ask them, do you have a primary care? Do you have someone? Because if you don't, we need to get you one. I can't be the sole provider. I'm a dietitian, and I work as a team with other providers. So a team approach is definitely helpful on your journey to better health.
Yes, it's so helpful. And I'm so glad for the work that you do. There's not many plant-based dietitians, that understand and that support patients in their plant-based journey. Sometimes they're actually discouraged by their doctor and their dietitian. So I'm so grateful that, I found you. We'll have the links to your website below. But if you could just share briefly, how do you work with clients? Let's say if there's someone who wants to work with you on a one-on-one basis or coaching basis, like what states and clients do you work with?
Yes. So currently I do group education in any state. So I do classes. If you want to refer to your patients to a particular class, that's fine. We do education in all conditions in this healthy eating. But if you want to do more one-on-one medical nutrition therapy, that's when we go over insurance coverage, depending on where state you are. I'm currently in the process of getting more licensure in other states. So, and also the Academy of Nutrition and Dietetics is working on a licensure compact, which means that if you're in a compact with a particular state, we don't have to reapply for licensure or whatever compact we're in. We could safely see those patients in those states. So other providers like nurses, physical therapists, they have these compacts where you could work outside of the state. So hopefully when that comes to fruition, we could reach more people, but definitely reach out if you want. If you're a corporation or organization that wants education and nutrition group classes, I definitely do that globally. And then if you want more one-on-one medical nutrition therapy, then we'll look into insurance. But I am here if you need help, and if you want, as she said, she'll put my website, but you could find me at 360girlsandwomen.com and talk about what your goals are. If you're looking to see a dietitian that's plant-based, and that's women's health, women's health.
Yeah, you see primarily women, right? Pregnant women.
Girls and women. Mm-hmm.
Yeah. Awesome. Well, this has been fantastic, very educational. Thank you so much to Ellen for joining me on the podcast on YouTube today. Yes. And my P3 family and viewers, thanks so much for tuning into this episode, and I will see you in the next video. Take care and have a blessed day.
Bye.